Welcome to Women's Health. Women's Health is a series of programs that are done by the Commission on Women and Gender, but they are funded by the Women's Foundation of Lincoln and Lancaster County. For a while now, during COVID, we have done a series of programs about the effects that the pandemic has had on women and children and their families. And we started out with talking about the eviction crisis. Then we moved to talking about childcare, and specifically not just about trying to get childcare, but also the effect that it has on childcare agencies. And we hope you'll reference those programs if you have a chance. This morning, we're talking about a very important topic, and that is the effects that the COVID pandemic has had on our children. So I'm joined by some really important guests. Our first one is Katie McLeese-Stevenson. Katie is the Executive Director of Hope Spoke. And I'm going to have her just tell you briefly a little bit about her agency. But let me also introduce Brenda Lajardro, who is the Supervisor of Counseling and School Social Work at the Lincoln Public Schools. Welcome, both of you. Katie, let's start with you. And if you could just give us a brief introduction to Hope Spoke and what work you do.
Thank you, Kathy. It's a pleasure to be here to talk about this important issue. Hope Spoke was founded in 1949. So for the last 73 years, we've been providing mental health services. We provide services across the lifespan, but we were originally founded to provide mental health services to children. And we were originally founded as the Child Guidance Center. And in 2018, we rebranded to Hope Spoke to better describe our work at this time. We provide outpatient services. We're in 16 of Lincoln's public schools this year at the elementary, middle, and high school level. And we also have a therapeutic group home for adolescent males. We provide services at the detention center for all youth that are in care there. And then we also have additional services through our extended day treatment program for 5 to 12-year-olds. Last year, we served approximately 1,500 individuals in the community.
Wonderful. Thank you so much. And Brenda, would you just briefly explain the counseling services? And I know that that's really hard to do, but if you could just tell us a little bit about your job.
Sure. Like Katie, I'm pleased to be with you today and happy to share information about how we serve students in Lincoln Public Schools. Lincoln Public Schools is the second largest district in the state of Nebraska. We serve approximately 42,000 students in pre-K through 12 programming. Everybody goes to school, so that's one thing that makes us a pretty unique organization. We want to be sure that all of our students have the tools that they need to be successful as they grow through the lifespan and into becoming adults in our community. So we provide services for students to develop social emotional competencies in elementary, middle, and high school. And then as they graduate, our plan is that they know where they're headed and how they can make a contribution to our communities.
Okay, wonderful. Let's start out talking, first of all, and of course, the pandemic has had just incredible effects on lots and lots and lots of different groups of people. But today, I think we want to really sort of zero in on the effects that it's had on our children, and perhaps maybe younger children, maybe age 5 to 10, 5 to 12, and then those who are of the teen years, the 12 to 18-year-olds. So do you see that we have had an increase in the last 2 years through this pandemic of needs for your services? And in what ways have they differed? Katie, would you start us out?
Sure. What we have seen specifically with our outpatient mental health services, either within the school setting or at our clinic at 2444 O Street, is a dramatic increase in need that's been expressed. For example, our outpatient waiting list has gone up 400% since the beginning of the pandemic. And that is startling for all of us. And also what we're finding is that when people have to wait longer for services, the intensity of their need increases. And so by the time someone is actually seeing a therapist, we've seen a dramatic increase in the needs that are expressed in those therapeutic relationships.
And Brenda, would you say the same thing is true in the schools?
One of the things that we use to help us address need is a multi-tiered system of support. So part of what Katie is talking about fits right into our model. When needs at the top end of that pyramid become really great, what we know is that we have to start addressing more needs at lower levels, because that's the way that we help our whole community, we help our whole student body. So we really have put a lot of emphasis on what we call Tier 1, which is the basis of our multi-tiered system of support. Tier 1 is the services that we provide for all students to help them be successful. So after the shutdown, which I can't believe has been almost 2 years ago now, we had a real concern about what happened to our students during that time. You know, many of them engaged with us in remote learning, but there were a lot of them who didn't thrive in that environment. So one of the things we did as we came back to school in August of 2020 is we surveyed students to try to learn what that experience was like for them in the lockdown environment, when they were isolated from their peers, their supportive community at school, and their families were isolated. We found some really interesting information. About a quarter of the students said that they were pretty happy being in that kind of situation. They didn't have to get up early. They didn't have to look right, whatever that means for each individual. They didn't have to deal with some of the stressful peer interactions, and they could go get a snack anytime they wanted to. So some of them really thought that was great, but there were a lot who said that they worried about getting behind in their coursework. They didn't get to see their friends, and so they were stressed about keeping those social relationships. And kids are social beings. We all are social beings, but kids are just figuring all that out. And so to be separated from a friend group that you don't know how it's going to be once you're all back together again, that was very stressful. And we had about 1,000 students who told us that they had experienced the death of either a family member or a close friend of the family during that early period of the pandemic. So we knew kids were really suffering, not just the social parts, but the grief, the loss, and the adjustment that creates for the entire family system. So we came back to school in August of 2020, knowing that our kids really were going to need that kind of wraparound feeling, that we're all a community. We need to get to know each other again. We need to focus on relationships between teachers and students and families, to make sure that we all felt connected again to school. So we have really emphasized that a lot in the last year and a half. And that, of course, is helpful to making sure that kids are doing okay. So that, as I said, is part of our Tier 1, that strong relationship and that connection to school and to each other. Tier 2 for us is group support, so students who need a little bit more. So we provide a lot of support for students, particularly after the pandemic. We increased the number of grief support groups that we have been offering. And we've been able to get back into doing some group supports for students who we know experience trauma. And then at the Tier 3 level, that's where our students access the services of a therapist, such as a therapist from Hope Spoke. So we feel like we've got great partners in people like Katie and Hope spoke, to help us meet needs of students, which certainly increased and changed during the pandemic.
Right. Thank you. So, Katie, what have been some of the most common problems that you've seen that have been related to mental health related things for children? If you want to maybe address all children or younger children versus older children, what would you say have been the most sort of pressing concerns?
Well, I think Brenda described how their world changed. And, I just heard on NPR a blurb that said 2020 was a time when children all across the world at some point were not in school. And so that is their job, right, at that age, to go to school. And that was taken from them. I would say that children have been experiencing anxiety and depression. Would be the two greatest things that we see. And Brenda mentioned trauma. And trauma comes in lots of different forms for children, and it might feel different than it does for adults. But taking away your peer group, that can be a source of trauma. Certainly having your parents be stressed about finances or their job or their health, all of those things have caused great trauma. And sadly, I would see that we've seen an increase in young people who have expressed feelings of hopelessness to the point of having suicidal ideation. And that's always been something that we've worked with. But I would say that has increased during this time period as well.
And so what kinds of, do children express those needs in the same kind of ways that adults do? Or do you find that sometimes it's hard for children to express the needs that they have?
Well, I think children express their needs all the time through their behavior. And sometimes it comes with words, and sometimes it's more behavioral in what they're doing or saying. And so it's important to really tune in to your kids. And if things seem different, that's really when we need to pay close attention and to be asking our loved ones, our young people, how are you doing? How are you feeling? And to talk about the future. And the future's been so uncertain for all of us, but it's important to keep kids focused on what comes next. And so sometimes if you're in that conversation and a young person, no matter their age, can't think about the future and can't express that, that's something that we need to tune into and pay attention to, because that might be expressing the severity of their feeling of hopelessness. And one of the things we know about children, and especially adolescents, is a hallmark of adolescence is that they don't necessarily connect behavior with consequences. And so a young person might be feeling terribly hopeless, but that doesn't mean they want to die. It means that they're feeling terribly hopeless and they want the pain to stop. And so that's really what we need to key into, is helping them work through the pain and the trauma and have hope. That's one of the greatest things that we can give to one another is hope. And really, I think what Lincoln Public Schools focuses on, and certainly our agency and other behavioral health providers focus on, is hope.
I think that Katie said it so well. One of the things that we do is teach lessons on suicide awareness. And this year in September, which is Suicide Awareness and Prevention Month, we did an entire district-wide message about suicide awareness and prevention. And it's really about reaching out when you're hurting. There are a lot of people who hurt in isolation. They think they're the only one who feels a certain way, or they're the only one who could possibly understand how dark things look. But just being able to talk to someone about how you feel opens a door to letting some light in and really changing the way that you may experience the world. So we did a lesson for all students in grades 6 through 12, a video lesson, and then a kind of a parent lesson, short statement for our elementary school students, just about, there are people here who care. There are people here who want to talk to you when you, no matter how you're feeling, but especially if you're feeling some of those really big, difficult emotions, reach out. And then we had a message to parents also, and in addition to some resources on our website that we hope will help parents and guardians and community members kind of understand things that they can do and ways that they can reach out to friends or family members or their children when things are difficult.
Great. And Katie, now the services that Hope Spoke provide, are those paid for by agencies? Are they paid for by individuals? Does insurance help pay for that?
Sure, it varies by individual, but we accept all insurances, and the greatest number of individuals that we serve have Medicaid as their primary insurance. And so then sometimes with insurance, people have a copay or a deductible. And one of the things that we really pride ourselves on is we don't turn anyone away for outpatient services based on their ability to pay. Okay. And so we have a sliding fee scale that we can take their copay even down to zero. We don't want people to be in a position to think, am I going to pay my rent, or is my son or daughter going to have mental health services? And so through the generosity of donors in our community, we are able to do that. And that's really important because, again, we don't want finances to be a stumbling block for such an essential service.
Right. And that adds to the stress of the family and lots of other things as well. So, Katie, will you tell us a little bit about the Surgeon General's advisory on youth mental health?
Yes. So in December of 2021, the U.S. Surgeon General, Dr. Vivek Murthy, released an advisory on youth mental health. And much of it talks about the impact of the pandemic and gives some statistics about the increases that are being seen across the country, especially in emergency rooms, which sometimes is where a young person and their family might turn in an emergency mental health situation. But it's a really great report, and it talks about what each of us can do. So it talks about what can you do as a youth? What can you do as a parent or a caregiver? Because many of the young people we're working with might not live with their parents, but they might live with other family members or grandparents, or they might be in a foster care situation. And then it talks about what can the schools do? What can the community do? What can funders do? What can local governments do? And so it really is a call to action and an advisory about what young people are experiencing. And I will say, for me, one of the few silver linings of the pandemic is that there's more talk about mental health and there's less stigma than there was. Prior to the pandemic, it was estimated that 1 in 5 of us dealt with a mental health issue. Now it's estimated that 1 in 3 of us deal with a mental health issue. And I would say it's probably 3 in 3. I don't know that anyone has gotten through the pandemic without feelings of anxiety or depression or hopelessness. And so hopefully this has perhaps changed the conversation or the way people look at services. That's one of the reasons why we just love being in Lincoln Public Schools, because as Brenda said, everyone goes to school. And there are some families that are very willing to have their child seen in a therapeutic relationship in the school setting that might feel less comfortable coming to a behavioral health clinic. And so that universality of schools really provides a unique place where services can happen.
That's great. I think you touched on something that maybe is what we're going to talk about just at the end here, and that is what the long-term consequences of the pandemic have been on children. And obviously, what you're saying is that the awareness of mental health issues and the sort of acceptance, maybe more by the public, of the fact that we all have mental health issues and that we can't exclude children from that. Obviously, they do as well. Can you think of other things that you would think might be long-term consequences for children in these situations?
Well, one thing that's for sure, normal isn't what it used to be. So we'll all be resetting. What the new normal looks like when we're back to something that looks more familiar is yet to be determined. But I think we really do understand better how important it is to take care of our mental health, to really be focused on those things that give us hope for the future, and to reach out when we're struggling. Those are, as Katie said, if there is a silver lining, that's it. We are much more willing to talk, and we're much more willing to seek help. So that is the best thing to come out of the pandemic. I think we have yet to see how things play out as far as once we get back to normal. In terms of academics, I can say it's still uncertain. I'm imagining we'll have a big gap between some students who really have thrived during this time and some students who have really struggled. How will we respond as an educational institution to help students get caught up and feel learners we know they are? That all has a big, mental health all has a big component of students' resilience and their ability to succeed. So I'm anxious to see how that plays out in the next few months. And I know that as LPS, we're here to make sure that we respond to those needs and that we consistently give students the best platform for launching.
I think there's some interesting research about the impact on individuals after a crisis. And, it talks about how when a crisis is over, and I don't know that we're over yet with the pandemic, that for up to 18 months and sometimes longer, there is a significant impact on mental health. And so some of that research has been done around, like floods and tornadoes and that kind of impact. But I think that it bears some similarity here to what we may see coming in the future when the pandemic, when we reset. I like that, Brenda, when we reset.
So finishing up, let's talk about where children can turn to if they have concerns, or if their parents have concerns, where should they turn to?
Well, we are very fortunate in Lincoln Public Schools to have several school-based mental health professionals. We have school counselors at all middle and high schools and in 27 of our 39 elementary schools. We have school social workers who serve all of our 61 sites, and we have school psychologists who also serve all sites. So even though those people are most of the time not full-time in a building, the service is still there. So we would encourage any parent who's concerned about their child, parent or guardian, caregiver, to reach out to their school. Could be one of those mental health professionals, or it could be a trusted teacher or administrator. And of course, for students, we encourage them to reach out to a trusted adult, whether that's at school or at home. Just know that there are people who care and people who are able and willing to help and connect families and students to resources that help meet those needs.
In addition to that, I would say sometimes the conversation happens at the pediatrician's office or the primary care provider for health care. And it's important to think about mental health when we think about physical health as well. And also, certainly all the resources Brenda mentioned within the schools. There are agencies like Hope Spoke and several providers in the community of mental health services for children. Folks can reach out to us at 402-475-7666 or through our website at www.hopespoke.org. And in addition to that, there are crisis lines locally and through Centerpoint, and Boys Town has a national crisis line. And there's also a parent line for parents to reach out to. So there are many resources. And the important thing is you're not alone. You're not the only one that's experiencing this. And as Brenda said, there are many, many trusted adults and professionals that are here to help.
Thank you so much. Well, both of you, we thank you so much for being part of our program today. We know that the pandemic has had many, many different kinds of effects on all different populations, but we can't forget that our children have come along with us on this journey and that they have some real considerations as well. And so this has been very helpful, very informative, and we really appreciate it. For those of you that are watching, we will put some of those websites and telephone numbers at the end of the program. If you are just listening to our program, hopefully you will be able to access some of those information and numbers through looking through internet sources. This program is provided by the Women's Foundation of Lincoln and Lancaster County. This is part of our Women's Health Series. And of course, you can also access the program through lincolnwomen.org. So again, thank you to Brenda Lajardro and Katie McLeese-Stevenson for joining us today and talking about children and the effect of mental health on children during the pandemic. Thank you.